Depression is more than feeling sad. Intense feelings of sadness and other symptoms, like losing interest in activities you enjoy, may last for a while. Depression is a medical illness, not a sign of weakness, and it's treatable. According to WebMD.com, an estimate of 19 million American adults are living with major depression. Here are some major symptoms of depression. For major depression, you may experience a sad or depressed mood or an inability to feel pleasure, plus 5 or more of the following symptoms I'm about to mention, for at least a 2-week period. Feelings of guilt, worthlessness, helplessness, or hopelessness. Loss of interest or pleasure in unusual activities, including sex, difficulty concentrating and complaints of poor memory, insomnia or oversleeping, appetite changes, which may include weight gain or loss, fatigue, lack of energy, thoughts of suicide or death, slow speech, slow movement. You may also experience other associated symptoms such as anxiety, agitation, irritability, a worsen of pain or coexisting chronic illness, or physical complaints such as stomach aches, headaches, or digestive problems. In children and adolescents, symptoms of depression may include insomnia, fatigue, headaches, stomach aches, dizziness, apathy, social withdrawal, weight loss, drug abuse or alcohol abuse, a drop in school performance, difficulties concentrating, isolation from family and friends.
Now, here are some statistics about depression. Who is affected by depression? While major depressive disorder can develop at any age, the median age at onset is 32. Major depressive disorder is more prevalent in women than in men. As many as 1 in 33 children and 1 in 8 adolescents have clinical depression. People with depression are 4 times as likely to develop a heart attack as though without a history of the illness. After a heart attack, they are at a significantly increased risk of death or second heart attack. With adults, depression often co-occurs with other illnesses and medical conditions. 25% of cancer patients experience depression. 10 to 27% of post-stroke patients experience depression. 1 in 3 HIV patients may experience depression. 50 to 75% of eating disorder patients, anorexia and bulimia, experience depression. 27% of individuals with substance abuse disorder, both alcohol and other substances, experience depression. 8.5 to 27% of persons with diabetes experience depression. Depression and suicide. Depression is the cause of over 2/3 of the 30,000 reported suicides in the United States each year. Untreated depression is the number 1 risk for suicide among youth. Suicide is the 3rd leading cause of death in 15 to 24-year-olds and the 4th leading cause of death in 10 to 14-year-olds. Young males aged 15 to 24 are at the highest risk for suicide, with a ratio of males to females at 7 to 1. Treatment for depression. Up to 80% of those treated for depression show an improvement in their symptoms, generally within 4 to 6 weeks of beginning medication, psychotherapy, attending support groups, or a combination of these treatments. Despite its high treatment success rate, nearly 2 out of the 3 people suffering with depression do not actively seek nor receive proper treatment. An estimated 50% of unsuccessful treatment for depression is due to medical noncompliance. Patients stop taking their medication too soon due to unacceptable side effects, financial factors, fear of addiction, and or short-term improvement of symptoms, leading them to believe that continuing treatment is unnecessary.
Women experience depression at twice the rate of men. This 2-1 ratio exists regardless of racial or ethnic background or economic status. The lifetime prevalence of major depression is 20 to 26% for women and 8 to 12% for men. Depression is more common in women because of biological, life cycles, hormonal, and psychosocial factors. Hormones directly affect the brain, and they control emotion and moods. Women are especially vulnerable since they go through menstruation, postpartum depression, and menopause. Research has shown that because women go through estrogen changes, they are more vulnerable to depression. But men experience depression differently than women. Whereas women have feelings of sadness, guilt, or worthlessness, men are more tired, irritable, and experience a loss of pleasure in things. But most women attempt suicide, but more men actually die. Also, when individuals go through surgery, they are more likely to go through depression. According to the American Heart Association, about 33% of patients will experience depression after cardiac arrest. It is common for people to be sad or depressed after this surgery or procedure. A year after open heart surgery, 63-year-old Oscar-winning actor and comedian Robin Williams died on August 11, 2014. Williams died in apparent suicide by hanging himself in his Marion County home. You should call your doctor if you or a loved one have suicidal thoughts or have other signs of either major depression or dysthymia. Also, if you are considering alternative or complementary treatments for depression, it's important that your doctor be aware of all aspects of your treatment. No, there's a distinct difference between feeling just sad or depressed and having a clinical depressive illness. If you have low spirits for a while, don't become concerned. However, if you feel you can't lift yourself out of your misery, or you begin to notice other physical symptoms such as a change in your sleep patterns, appetite, or energy, seek help.